Well, hello and welcome to our webinar for nurses, midwives and allied health professionals. My name is Simran Obori and I manage the PhD programme in mental health research for health professionals. I'll be administering our webinar today, where we'll soon be hearing from the rest of the webinar team. Before we start, I just wanted to remind everyone that this session is going to be recorded and uploaded to our website later today. So please mute yourself during the presentation to minimize any disruptions. You'll have a chance to ask your questions at the end of the presentation, so you can pop them in the chat as we go and we'll come to them, or alternatively, you can use the raise hand function and we'll call your name at the end of the session when we're ready. All right, I think that covers all the housekeeping. So Alan, you can kick us off.
Thank you very much. Are you going to put the slides up, Simran?
I thought I was already sharing my screen. Sorry, let's try that again.
That's it. Lovely job. Yep, lovely. Thank you very much. So, afternoon, everybody. Thanks for joining us. Hopefully, most, if not all of you, saw the longer presentation earlier with details of the full program. So we won't rehearse all of that. We can touch on it briefly. But if you missed it, the recording of that will be going up on the website very, very soon. So I'm Professor of Mental Health Nursing at King's and one of the co-directors of this PhD program. Apologies from Matthew Hotoff, who's the director. He's had to go to another meeting at this time. But I'm fortunate to say we have Professor Sandrine Thuret and Professor Stephanie Hatch with us this afternoon, who are both co-directors on the programme, and Professor Catherine Evans, who's Professor of Palliative Care and also Deputy Director of the King's Clinical Academic Training Office. Now, I must say we're very lucky to have a Clinical Academic Training Office, and Catherine will be telling you more about that this afternoon. Next slide, please. So we'll just give you a very brief recap on the key information about the programme, and then I'll invite Stephanie to speak to you about our equality, diversity and inclusion goals of the whole programme. And then Catherine will be speaking to you about the Clinical Academic Training Office. And then we'll be looking in more detail at the clinical academic pathway for nurses, midwife and allied health professionals. And then we'll be giving you quite detailed guidance about the first stage application process and what you need to do for that. And then we can open up to address any of your questions. So if you have any questions, either hang on to them and put your hand up later, or if you feel like it, you can put questions into the chat function and we'll take them when we get to that part. Thank you very much. Next slide. So just very briefly, the PhD program, which is funded by the Wellcome Trust and run by King's College London, offers 5 fellowships a year for 5 years, starting October 2024. The 3-year fellowship will cover people's home fees for registering with the university to do the PhD. It will cover your existing salary and research costs of up to £50,000, which is a very generous offer. There's also travel expenses available, including for childcare and training costs. The PhD will be awarded by King's College London. And people have an option. You can either, and this is probably the best option if possible for you, is to become employed by King's College London, and you get all the benefits of that. Or in some cases, you can be seconded from your employing organisation and do your PhD and be registered with King's, but remain employed by your host organisation. The full eligibility criteria available on the website and full details of the full programme are there. And as I said, mentioned before, we gave a longer webinar earlier with full details of that programme and breakdown of all the stages. And so if you want to have a look at that, have a look at that. I think that'll be up there later today, Kirsten, am I right? Yeah, lovely. Thank you. This session is particularly targeted at nurses and allied healthcare professionals and social care professionals. And that's for a number of reasons. First of all, within the research workforce in universities and in health service. Nurses in particular, but also allied health professionals, are underrepresented. We're low in numbers, and it's harder and it's less worked out how to develop a clinical academic career. Those pathways have not been put in place historically, and there are particular challenges for nurses and allied health professionals. So it's those combination of factors that we're keen to try and address to level that field a little bit. And that for many people who are nurses or allied health professionals, you may have come into the profession later in life. You may have not had the academic opportunities that some other healthcare professionals have, and that may at times be a barrier for you applying for other funding programs. So we've very much targeted it as trying to recruit people who are from those professional groups as a positive aspect of this program. And it's very much about trying to help you obtain funding to do a PhD with a view to then developing a clinical academic career. Thank you. Next slide, please. So, Steph, would you like to say a little bit about the EDI on this program?
Yeah, great. Thank you, Alan. I just wanted to emphasize here that EDI principles really underlie all of the processes that we undertake within this program. And it's not only important for us in terms of the way the program runs, but also for you in terms of thinking about EDI within your own work. And if that doesn't resonate immediately, also, think about EDI principles underlying your ways of working. So thinking about for us, it's around making sure, as Alan said, that we have an inclusive program. So inclusion for us is a practice. And it's really for us here about identifying these 3 underrepresented groups and strongly encouraging those who are from these groups to apply for this PhD program. So the first group that we identified is health professionals with lived experience of mental disorders. The second, people from diverse racial and ethnic groups, so encouraging those from racial and ethnic minoritized groups in particular. And then also nurses, as we've heard, because of the underrepresentation. So I'll leave it there. If you'd like to hear more about how EDI and also how it's related to our ideas around developing and maintaining a positive research culture, please do check out the webinar which we had earlier today, which will also be on the website. Thank you.
Thank you very much, Stephanie. And Catherine, if I could hand over to you to talk about the King's Clinical Academic Training Office. Thank you.
Yes, of course, Alan. Welcome, everybody. So as Alan said, I'm a clinical academic in palliative care and nursing, and I'm one of the deputy directors for the King's Clinical Academic Training Office. So just as Alan said, we're very fortunate that we have this investment to support clinical academics. And I think the key feature of the Cato office is its emphasis on being pan-professional. So this is about supporting clinical academics across all of the health and increasingly social care disciplines. So medicine, nursing, pharmacists, clinical psychologists, physios, whole breadth of different disciplines who are particularly studying at King's. And in terms of our number of PGR students at the moment who also have a registered health discipline, there are nearly 700 of them at King's across all of those disciplines. So supporting the successful career progression of clinical academics is something that's very much a priority for King's. What you can see on this slide is how we are seeking to enable people to pursue successful careers as a clinical academic. So the slide just shows our 4 strategic pillars, with it in developing clinical academics at King's. So you can see this is about championing clinical academic careers. So this is both on an individual level with, for example, case studies on our Cato website, right the way through to organisational level in the contract process between, for example, King's and our NHS partner trusts, through to regional level and national level around improving, particularly for nurses and midwives and AHPs, the smoothing really of that clinical academic pathway, which is often quite tricky. And then right the way through to capacity building. The Wellcome funding that we're talking about today is a great example of that. The office is then also offering bespoke training. So, for example, around writing for publication, seeking fellowship applications, understanding about career pathways and how people have constructed their pathway as a clinical academic. And maybe most importantly is that we are a central visible hub. So the QR code there that you can scan takes you to our newsletters, takes you to our website. We have all our resources on a SharePoint folder, which you can apply for access if you are outside of King's. It's not a problem to open that to everybody. Next slide, please. And what this depicts is sort of very broadly an overview of what that clinical academic pathway looks like for a nurse, midwife or allied health professional. Very much moving through that from the beginning, from research internships, from initial exposure, to the middle, which is for individuals now who are applying for doctoral funding. But importantly, the support that's obtained in undertaking the doctorate, but to enable that transition to being a postdoctorate and then to an early career researcher, if that's the career pathway that individuals are choosing to pursue. Thank you.
Thank you very much, Catherine. Sandrine, would you like to talk about the application guidance? Thank you.
Yeah, I can do that. So I put in the chat the link for the application. For the people who were at the earlier session, I went through that, but here we go through it a little bit as well. So you will see in the application form, I encourage you to download the template, the Word document, so that you can access on the website. So you can prepare your application in the template, and then you can copy paste all your answer directly on the online application. It would be much faster and safer as well for you. And you will see that in the application, you can although you can tick all 3 areas, but we encourage you to choose, maybe 1 or 2, all 3, why not? Maybe if your project is cross-cutting, do cross all 3. Otherwise, help us by telling what the main or the dominant area. Then we want to understand what motivates you to pursue research in mental health, and this is one of the clear questions. And then what research area are you most interested in, and how research in this area will lead to improved mental health of individual or population. So this is one of our main questions. And you will see each question has a word/character limit that's clearly indicated. So do respect that, otherwise the form will cut you off, that's for sure. And then we want to understand what you have learned or gained from exposure to or experience of research. So as I mentioned, it does not have to be something, a formal MSc. It might be something that occurred during your professional life, your exposure to research, and how this has led you to apply to do a PhD. And then the final question that's really important for you to reflect is why do you need a PhD to further your career and research aspiration? So be very mindful of that. This is often an area where when we read the answer within the panel, we might not be convinced that what you want to do next would need a PhD. So have think about that last question. It's really important to reflect what you think you will gain during this PhD program and how you really need it to fulfill your professional and research and career aspirations. And then there is a final section to describe in a more formal way what has been your research training. So you have more space here to give some details. Anything more you want me to cover, Alan, on that?
I think that's
that's a
it.
summary. But again, download the Word document, and you will see in advance the question that you are being asked.
Thank you very much. Yes, and I think it's worth saying that it's worth having a look at those questions. And Sandrine certainly said this at the earlier session, to really think about how you best answer that question, and don't write answers to questions that aren't there. Think about what's actually being asked and how you can best show evidence of what we're asking for. So if we're asking you about, tell us about your research experience, any research experience that you have, don't spend 200 words telling us all about your clinical experience, unless you can show how that's linked to your research experience. Think about what the question's actually asking and address that. And I'm saying that very deliberately, because I have seen quite a lot of applications from nurses where they have vast clinical experience, and that tends to be what they will tell us about. But we need to know, how have you used research? How have you read or had contact with research in some way to inform your practice or develop your research knowledge? So thank you very much. That's a brief overview of the programme and some of the information about applying and the support that's available throughout King's and the Clinical Academic Centre. And so now we'd very much welcome any questions. Can I say very clearly at the very offset, there are no silly or stupid questions. So if there's something you want to know and you're not sure if you know the answer, or you're not sure it's on our website or we've already said it or not, just please put your hand up or put a comment in the chat, and we'll pick them up. Thank you. Haven't seen any questions yet, Gursimran, am I right? Oh, there we go.
No, I think John's got his hand up.
John, please. Thank you.
You hopefully just break the ice a little bit here.
Thank you, John.
Thank you. Just a few, if it's okay. So firstly, what's the situation with sort of clinical work? So if you're in your clinical job, sometimes it's difficult, I guess, to sort of move away from that. Is it possible to maintain any clinical sessions at all?
Yeah, this program very much encourages that. So we are looking for people to do a PhD around about 4 days a week, and then the other day we'll be continuing your clinical input. I think if you were thinking about applying for this, and certainly if you got shortlisted into the second phase, I would start having conversations with managers and stuff about, will you support me going for this? And starting to think about how you might manage that in terms of your clinical role. And I think the more support you get from an early stage is going to be hugely beneficial. If you're applying and that's something you wish to speak with us about, then we would be happy to talk about that. But yeah, maintaining that clinical contact is valued and seen as an important part of this program. If anyone wants to add anything else to that, please shout. You had other questions?
Yeah, is it okay to? I don't know.
Yeah, please do.
So just looking at the list of supervisors. So I'm just thinking about sort of timescales for kind of working up a project proposal if you got past the second round. When would be an appropriate time to contact the list of supervisors that are on the website? Is it too early now just to have a sort of an informal discussion about an idea? And related to that, what's the position with sort of external supervision? If, for example, if someone has sort of methodological expertise that you couldn't sort of maybe see in the list of internal supervisors, is it okay to sort of speak to them?
Thank you. Good question. Sandrine, would you mind picking that up?
Yeah. So I would say, obviously, browse our website to see, indeed, to identify some potential supervisor. You could approach them if you want, but be mindful that some of them will be busy, so they might not be immediately responsive. But for sure, at stage 2, they would be told, now be expected to be approached by potential candidate. At this time, they haven't been told, we have done stage 1, now candidate have been selected and they will be approaching you. but feel free to do that if it helps to make up your mind if it's for you or not, and have this discussion, of course. Regarding having a third supervisor from outside, like there might not be an official supervisory role, but they might be consulting on, or a collaborator, because a lot of the research projects have collaborators. So you can see closer to the time, indeed, when you put your stage 2 application, where there is space indeed for your 2 Kings-based supervisor, and then a third one might be a collaborator indeed.
Thank you.
Thank you. Thanks, Sandrine, and thank you, John. So I see there's a question from Afra. If we get to stage 2, should we be seeking 2 supervisors from the list you provide? Again, Sandrine, can you pick that up, please?
Yeah, so we would say yes, that would be the idea. You don't have to, both of them do not have to be on the list, so you can have one from the list for sure, the first one from the list, but you could add another one that's not necessarily on the list, but this would have to be checked so that the other supervisor is eligible to be a PhD supervisor, because at King's and within our PPN, we have clear criteria as who is eligible to be a supervisor or who is not. But I would expect that when you are putting your stage 2 application, the primary supervisor you are going to choose to be working with would be able to guide you and check with Gursiram, or, is the potential other supervisor eligible to be a supervisor administratively. So, have all the requirement, has done the training, as the track record, and so on to be an official supervisor.
Thank you very much. Anne, you've got your hand up for a question.
Yeah, I mean, if this is something that you're sort of thinking about in the future and you sort of know you're not quite ready yet, could you give a bit of guidance about what sort of activities, what sort of skills you kind of could be developing or learning from a sort of research point of view to make a strong application in the future? So obviously as an MSc, obviously there's some quality improvement projects at work. Anything else that you would sort of encourage us to do if we were thinking about doing this in the future?
It's a really good question. I will have a first bash and then I'll ask my colleagues to chip in. So I've just supported someone who was lucky to get a pre-doctoral fellowship free. In fact, I just supported 2 people to develop PhD ideas. So that gave them a bit of sort of time to do that. And I think they did a number of things. One was reviewing relevant literature. You might do that as a formal systematic review or a scoping review, but just to try and, in a structured way, get a very clear idea of your understanding of the literature that's relevant to something that you want to explore. Make sure other people haven't done it, but also what have other people done? How are they studying it? How are they exploring it? And that introduces you as well to methodologies and methods which can help inform you and think about what you might do in your project. So I think that's very useful, whether you do that as a formal piece of work or a more informal piece of work for yourself. I think any opportunity to start drafting and writing out ideas for a project and getting other people to have a look at them and feedback on them. Talk it through with some of your colleagues, go knock on the door with a researcher down, in your institution or something, and just say, look, I've been thinking about this, what do you think? Because very often it's when we start to share those ideas with others, we ourselves hear weaknesses or difficulties or things we haven't quite thought through, or people will critique our work. And a big part of being an academic and doing research is being open to critique, not getting defensive, but hearing what people are saying, helping think about, oh, actually, that's a good point. I haven't thought, how would I recruit people in that service? Or how would I get people to fill in 27 different questionnaires? And it gets us to think about what we've not quite thought through. So that would be my 2 to start with. But anyone else want to chip in on that?
I think that was great, Alan. And I think just also speaking to people who have already been successful. We have an a growing cohort, 2 cohorts now, and sort of getting in touch and talking to them about what their experiences were, particularly if they come from the same specialty area.
Yeah.
My name is Susie. May I be cheeky and jump in here with some advice?
Please do.
Yeah.
So I'm a physio. I work for Serona Health and Care, and I can see, Anne, you work, I think, for UCL, or University College. It might be worth doing some digging, which I did in my organisation. Most trusts will have some sort of like research committee, which you might not hear about day to day. I was lucky and it just popped up, and so they actually let me join the research committee so I could go to meetings and be a bit more exposed to research. So it might be worth having a look at your organisation if you're able to do that.
Yeah, sure. Thanks.
Thank you. That's great advice. And most, if not all, NHS trusts now, if you're working in an NHS trust, will have research leads and research departments. And I think if you drop an email, go and knock on someone's door, most people will be willing to give you some advice or point you in the direction of someone they think might be better at doing that.
Yeah, I've done that, so I've sort of started the process. So
lovely.
That's good. Yeah.
Good stuff. Thank you. I'm just going to go to some of the questions in the chat. So Eleanor has said, re-stage 1 application. You ask, how might research in this area lead to improved mental health of individuals or populations? I'm wondering if you want us to start pitching a specific proposal at this point, explaining why research in the area I'm interested in would be impactful, or speaking in more generic terms of the impact of research on mental health, or citing how pre-existing mental health research has had impact, for example, incorporation of CHIME study into my workplace ethos safety planning procedures. Very good question and a very good idea for your project. I think any and all of those really. I think I would certainly be keen to see someone who's got an understanding and a broad overview of how research is perhaps informing practice or could inform practice. And then I think if you had a specific area of interest, if you could talk about that in more detail and how you thought research might either has or could inform that or bring about improvements for individuals or populations, that would be very useful. Anyone else want to add in on that?
I just think it would be useful for us to see, don't keep it too general either, because we want to see how you would come into that idea, or what has been already your contribution, or how you have been exposed to that. So write it in a personal way, not just like, from a spectator and just telling us, that would have an impact. It's like how you have been involved in that context, or how you see yourselves to be involved in that.
Thank you very much. Patience has asked, how do you maintain clinical work if your work is tied to a visa? For instance, I'm on tier 2 visa and I will lose the tier visa if I have to pursue this program. In that case, will the school find a placement for me to maintain clinical work? Also, if I'm eligible to apply for this program, considering my visa status, I'm registered with the UK NMC. So first of all, by being registered with the NMC, you are eligible to apply. I'm no expert on visas, but my thought on this is probably that we could help try and identify possible clinical placements. But Catherine, do you have more on that? Or anyone else?
I'm not sure, actually. I think I would probably just check with our visa compliance at King's, because I know it's very obviously precise information. So I think I would probably check that with the compliance team at King's, and they would be able to advise.
Yeah, I think that's good advice. I was just thinking as you started to talk, you need to get the right advice on something like a visa, don't you? Because we don't want to end up you being kicked out of the country for no good reason.
But what we can say, just as a matter of getting to the stage of applying, I think you should definitely apply, because as we covered in session 1, we have a couple of fee waiver for international students, because it looks like you would be an international student if you do need a visa. And as Alan said, you are eligible to apply because you are UK NMC register. Maybe what we can say is that you do not have to continue clinical work. This is optional, right? So you can do this PhD 100%. So you don't have to have a clinical placement. So that's another option, in case this visa issue would be a problem. But I'm just thinking if it could be considered as well, if you do the program 100%, but you want to keep your clinical work going, you could do that as voluntary, so something like that. So I think there are different options to explore in case there's an issue with the visa, if you would get onto the program. So I wouldn't leave the visa issue deter you to apply. That would be for now my take-home message. But indeed, checking, if you want to really have a clear answer, checking with visa compliance would be the proper way to do it. But I'm not sure they will have an answer to you. Mm-hmm. That's what I'm saying, without the exact case and the exact yeah.
Thank you, Sandrine. Oh, I had a question lined up and it's just disappeared. Hang on. Eleanor has asked, does being part of a research project count as formal training? I've had to be signed off on GCP, General Clinical Practice, and site file management, but I'm aware this is a different skill set to designing studies. Yes, it is different. Any involvement in research, tell us about, anything you've got involved with. It shows, some interest in conducting research and some knowledge and understanding of what that requires. And certainly GCP training and awareness of things like site file management for research projects is useful knowledge. So anything at all, if you help collect some data on a study or help recruit participants into a study, anything at all that shows that you've got some interest is going to be beneficial. Susan says, as a follow-up to Eleanor's question about the question regarding possible research impact, are references required? They aren't required, but if you had done work that had outputs and you could show evidence of that, that would not do you any harm whatsoever. I think, if I remember rightly, there's a section on the form when you can add in outputs, reference outputs and so on. Yeah, getting nods from the team.
Yeah, there is I think it's called publication, but indeed, if you have. Yeah.
In regards to question 4 and the application about what we have learned, gained from exposure to research, should we only list how what we learned has impacted our clinical work, or would you like to know more about specific research skills we have learned, for example, data collection? So all of the above, any and all of that. So anyone who's listening there thinking, well, I've applied research in my practice, or, I've had a small partner study or whatever, do mention that and do show that as evidence. But any of those things in that question.
And if you don't have enough space there and you want to highlight a specific technique you have learned, you can put that under question 6 when it's open, and when we are giving as example methodological training. So let's say if it doesn't fit all in there and you want to give more detail, then you could use question 6 as well.
Great stuff, thank you. And I see someone's hands up, so let me click a button, hang on. Wahida, can I ask you to ask your question?
Hi, thank you very much. So my question is, I'm a practicing midwife, and I'm very passionate about inequalities and perinatal mental health. So what I wanted to ask was, if I was accepted on the course, would King's arrange kind of like 1 day a week honorary contract to get exposure with these communities? I mean, I already have some exposure where I work, but I mean, I'm employed in a different role. But ideally, what I wanted, is there any support for that kind of, for me to obtain that exposure with perinatal mental health service users or pregnant people?
Thank you. So thanks for your question. First off, to say that's a really interesting area of study and something that would be right down the street of this program. So hope you apply. Yes, I think we could certainly work with you to see whether or not we could identify appropriate clinical placements for you. But does anyone want to add anything to that?
So I have members of my health inequalities research group that focus on this area, and we'd certainly, whether it be in terms of working with communities, with services, but we also have contact with policymakers in this area. So very close contact through the work that I do at the NHS Race and Health Observatory. So there are many possibilities, but we would need to think specifically around the clinical aspects. But certainly in terms of, thinking about how this research area, findings and evidence generated in this research area reach both the community as well as policymakers, that's certainly something that would be possible.
Brilliant, thank you.
Thank you, Stephanie. Any more comments or questions from anybody?
Could I just ask one other question, please?
Yes, please do.
It's just to do with the pay. So how's that negotiated with? How does it work? Sort of in terms of matching or not, your NHS salary.
I'll tell you my understanding of it, and then I'll ask Simran. So basically, at the point at which we're negotiating sorting out the contract, you would contact your employer to provide evidence of your current salary, and then the fellowship would provide an equivalent sum. Would that be right, Simran?
Yes, so we usually request up to 3 recent pay slips from that period, and then we liaise with our finance team to try and match the salary as closely as possible. And we would be able to support you and provide details about that at that time.
And can you keep your pension contributions in the NHS scheme if you do take up employment in KCL?
Yes, there is an option to either keep an NHS pension or start on a King's pension, but it would depend on the type of contract that you're on and your clinical involvement within the NHS trust that you're working at.
Okay. And if a Labour government comes into power in the next year and our salary gets put up in the NHS by X percent, can I have an ironclad commitment that it will be met?
I was going to do an imitation of Starmer saying, obviously, we can't commit to anything at this point. But no, more seriously, I think we try and honour pay increases. Let's hope you get one. There's another question from Susan. In regards to question 3 of the application specifically, what research areas are you interested in? I presume that as the question is worded as areas that it's okay to list more than one if we have numerous interests, being mindful of word count and best use of it. Yeah, absolutely. I think, as Sandrine said earlier, it probably is better that rather than giving us a list, I mean, I can remember one application last year, actually, which there was problems sort of someone listing, 9 or 10 things that they thought were really, really important. Well, that's great, but what do you want to focus on? So I think if you've got a number of areas, that's great. But if you can focus on 1 or 2, that's going to be more attractive in thinking that you're beginning to think about what you might try and address in conducting a PhD. Rather than just some broad brush approach to, doing a PhD would be a good idea, and I've got all these thoughts. So it's starting to show that you're beginning to think about what you would focus on. Are you automatically given an admission for a pre-doctoral admission if you don't get admitted to the PhD? No. Where have we got to on that, Gerson, or anyone else?
I can try.
Thank you, Sandrine.
Yeah. So basically, after you start your PhD, the PhD program, between 9 months and 18 months, we have an upgrade process. So where students are then deemed to be ready to move to the next stage. So then you are really moving forward, but that doesn't give you an MPhil. This is what what you would get. So let's say if you don't go through all the way with the PhD, you can then say, okay, I want then to apply for an MPhil. And then you still have to submit a formal thesis that has different requirements from a PhD. For example, the Wellcome is a big one. So there's different requirements. So but you need to hand in something to get the MPhil. So it's not that if you fail the PhD, you get one. No, it's very different. But at the end, often the examiner are going to propose, if they fail on the PhD, they are going to propose you to submit this as an MPhil. If it's your decision to stop early, then you can write towards getting an MPhil. But nothing is given automatically.
Thank you for that, Sandrine, although that's not quite what the question was about. It was about if you apply, my reading of it is if you apply to do this program and then don't get offered a place, can you automatically go on the pre-doctoral fellowship program? So we have funding for a small number of pre-doctorate fellowships, and we've just renegotiated some funding for that. But Gersenrand, can you remind us where we're at with that in terms of applying for it?
Yes, so there are a few preparatory fellowships available on this program. However, there are strict requirements as to who is eligible for it and how the funding can be used. And so you do need to meet those requirements in order to be awarded that fellowship. I think the full details are currently on our website. So if you go to the facts page, you should be able to find that information. Yeah, I think that covers it. That's as much as we can say at the moment.
But it's definitely not automatic. I mean, there's a selection.
No, there's a process of selection. So I think what I would say, patients, is at this stage, make your application. Hopefully you get through. And if you don't, then it might be something that we can revisit you subsequently and explore whether or not you're eligible to apply for one of those pre-doctoral fellowships. There are other schemes out there, and maybe, I don't know, Catherine, if that's something you could pick up. There are other funding schemes out there for people to apply for pre-doctoral fellowships. I've just supervised a couple in the last year, and I've got someone applying at the moment. Anything you can add to that, Catherine?
So the other pre-doctoral one, so there's ones funded by, well, what was Health Education England London, so the equivalent now for London. So they offer 10 pre-doctoral places each year. It's a much smaller pot of money than the NMAHP PCAF scheme. So the HE London one is obviously for London only, and that's basically backfilling £5,000 per year to release people. And then some of the NHS trusts also fund research internships. So again, Guy's and St Thomas's offer that. It's a competitive process. SLAM, I understand, also are doing that. And it might well be in people's respective NHS trusts that there is opportunity for research internships to support the development of doctoral fellowships.
Thank you very much. I think as well, if you're a nurse and you're registered with the Royal College of Nursing, I think they either do have or are about to have some supportive workshops and stuff for people who are at this stage of their career and looking to develop their careers. But there are other things around. Yeah. So it's worth having a look. Burdett Trust for Nursing is another organisation that sometimes funds people for preparatory work. Some ARCs also offer internships to get research experience. Great, thank you. I'm just going back to hands up. Susan?
Hello, thank you. I have two really quick questions, if that's okay.
Mm-hmm.
The first one is that I am currently only working in my clinical job part-time because I do actually do research work 2 days a week, like as a research assistant. So if I was to do the PhD full-time, would I still get my salary on a full-time basis?
Gersenrand?
Yes, so if you enroll in the PhD program full-time, we would match fund a full-time salary. That's the equivalent to your FTE for your current role.
Thank you. And my second question is that some of my research experience is not necessarily related to the thing I want to pursue, but as you may know, sometimes when you're looking for sort of research assistant roles, you just have to, you know, take what you can get that is peripherally related. So I'm hoping that wouldn't be like an issue.
No, not at all. I think, again, any research experience is going to be helpful and relevant. No, you're absolutely right. Many of us have taken jobs in things that we didn't particularly weren't keen to study, but it was a job and it gave us experience. And I think I know from my own life and career, I didn't have a career trajectory that I was anticipating working out in the way it did, but certainly different experiences in different jobs, and not just research jobs, led to me having skills that were then transferable into other applications. And so, yeah, just draw on anything that you think might be helpful or useful. I'm going to take probably the last question because we're just about out of time, from Jackie, who's wondering, I was wondering if the program considers global mental health research topics, issues, or mental health research focused in sub-Saharan Africa. Anyone pick up on that for us, please? I think we do, don't we?
Yeah, I think the short answer is yes.
Yeah,
definitely.
I think we do. Yeah, thank you. I'm right, aren't we? We're due to finish at 2:15, was that right? Yeah, we were. Thank you very much. So thank you very much for all of your questions and for coming along. Hopefully we've addressed some of your concerns, if not all of them. The links for various programs and projects and the website are in the chat and on the screen. So do have a look at those. If you have any further questions, it's the Cato address, is it, at Gerson-Ran. So any further questions you think you still have, please email kcato@kcl.ac.uk and we will get back to you as soon as possible with any responses. Can I remind you again on the website, this recorded webinar will be placed there, as will the earlier one with the more detailed information about the programme. But all the information about the PhD programme is on that website. So do have a look there. And if you're thinking about applying, I encourage you to do so and wish you the very best of luck. Thank you for coming along. Thank you for all my co-panelists. Thank you very much.
Thank you.
Thanks, everyone.
Thank you. Bye.
Thank you.